To safely load a scalpel blade onto a scalpel handle, first, grab the backside of the blade from the package with a pair of needle holders. Because you will be wearing sterile gloves when applying a scalpel blade, the blade will already have been opened into your sterile field. Manipulating the blade from the backside prevents damaging the cutting surface. Next, holding the scalpel blade down and away from your face, insert the blade into the blade holder. Using your fingers to insert a scalpel blade can be dangerous and should be avoided. For the fingertip grip, the blade handle is held between the tips of the middle and ring finger and the thumb. The index finger rests on the top of the blade and allows for downward pressure. The blade is held perpendicular to the tissue to be cut, and the tissue is cut in one smooth motion. The fingers of the opposite hand provide lateral tension on the skin as the blade is moved through the tissue. A sawing or hacking motion is not desirable and will result in excessive tissue trauma. Because this grip maximizes the contact of the scalpel blade to the skin, this grip is useful for longer incisions such as the skin incision for an abdominal exploratory or spay. For the pencil grip, the handle is held like a pencil. Again, the index finger rests on top of the blade and the blade remains perpendicular to the tissue. The fingers of the opposite hand provide lateral tension on the skin as the blade is moved through the tissue. Because a surgeon is able to stabilize their hand when performing this grip, and just the tip of the scalpel blade is employed, this grip is for short, more precise incisions. The palm scalpel grip offers the most power, but the least control. The fingers wrap around the scalpel handle, and the blade rests on the surface of the palm. The index finger rests on top of the blade. The blade is held perpendicular to the tissue, and lateral retraction is provided by the opposite hand. To make a stab incision using the press cutting method, hold the scalpel like a pencil, but use your middle finger as a bumper to stop the motion of the blade. This technique is used to make stab incisions into an organ, like the bladder or stomach. Typically, the incision is extended with scissors after a stab incision has been made.